Today we're going to talk about, things down there. So like, are you feeling dry, sore, and uncomfortable down there since perimenopause or menopause or even postmenopause? We're going to talk about what's causing that and what to do. Welcome to my channel. If you're new here, I'm Dr. Lori Marvis. I'm a board certified family and lifestyle medicine physician licensed in all 50 states and DC to see patients about all things women's health and, of course, plant-based diet if you need some more help with that too. So let's dive right in on why you might be having these symptoms and what you can do about it. All right, first of all, when if you've noticed the dryness, the discomfort during sex, or even more frequent trips to the bathroom since entering perimenopause and menopause, you're really not alone, right? So many women face these challenges. I can't even tell you how many patients I've seen that talk about this. But again, they're not often talked about in regular medical practice because they're dealing with hypertension or high cholesterol, but they just are too embarrassed to talk about it, or they are going to be told it's a normal part of aging. But the truth is, these symptoms are part of a treatable condition called Genitourinary Syndrome of Menopause. Now, we're going to talk about what it is, why it happens, and how you can effectively manage it to reclaim your comfort and confidence. Okay. So, first of all, what is Genitourinary Syndrome of Menopause? Let's call it GSM for short. It's basically a term describes a wide range of symptoms that affect the vaginal, urinary, and sexual health of women, during that menopausal transition, perimenopause, menopause, and postmenopause. It's caused by lower estrogen levels, which leads to changes in the tissues in the vagina and the urinary tract. So estrogen really plays an important role in keeping those tissues thick, elastic, and well lubricated. So when estrogen levels drop, the areas can become very dry, thin, and even more prone to irritation and infection. So what are the common symptoms? First of all, you'll notice vaginal dryness and irritation. The vagina might feel itchy, dry, or sore due to the thinning and reduced moisture. This can make everyday activities like walking or sitting even uncomfortable, let alone having sex. You may even hear some women complain that it hurts to wear pants, that it hurts to ride a bike, even. Next, we talk about painful intercourse, right? So without adequate lubrication, sex can become painful, and that can lead to a condition called dyspareunia. This isn't just uncomfortable, it can affect intimacy and make you want to avoid sex altogether. So, first of all, you might also notice bladder symptoms. So, the loss of estrogen can weaken the tissues supporting the bladder and the urethra, which is basically where you urinate. And that can lead to more frequent urination, sudden urgency, and even leaks when you cough or sneeze. And finally, I think one thing that's a lot of women don't even consider this is a recurrent urinary tract infection. Really see this, especially in my postmenopausal ladies, right? These thinner tissues and reduced vaginal acidity create less protective environment, increasing the risk of UTIs. Plus, there's some anatomical shifting that occurs that can increase that risk. Next, GSM is not something that typically resolves on its own, right? In fact, it often gets worse over time without treatment. So unfortunately, many women don't report those symptoms because they feel embarrassed or they assume it's just part of aging. But remember, GSM is not inevitable, but there are some effective solutions. So when we talk about that, why is it actually happens? So we talked about the symptoms, what it is, but now we're going to talk a little bit deeper on why it actually happens. So again, as you produce more estrogen or produce less estrogen, that really causes a few biological changes. So first, you get the thinning of the vaginal walls, right? So once they were thick and elastic, they become thinner and more fragile, making them more prone to tears and irritation. Also, you get reduced blood flow. So with less estrogen, there's a decreased blood flow to the pelvic area in general, which means less natural lubrication, leading to dryness and discomfort. And then again, changes in the vaginal pH. So normally the vagina has a very low pH, creating an acidic environment that protects against harmful bacterial infections. So when the estrogen drops, pH rises, increasing susceptibility to infections like bacterial vaginosis, which you may have heard of as BV. So how do we manage it? So first of all, it can be a chronic condition, but it's very manageable with the right approach. So there's a few things to consider. There's 3 different types of treatments that we're gonna talk about. The first is non-hormonal treatments. So, number 1, you probably heard your doctor mention, if you have spoken to them about this, vaginal moisturizers. So, unlike lubricants, these actually provide temporary relief during sex. So, moisturizers help maintain the vaginal moisture over a longer period. So then you apply them a few times a week to really kinda keep the tissues hydrated. Number 2 is lubricants in the same non-hormonal. Lubricants for sex, right, is using like a water or a silicone-based lubricant during sex can be really prevent the pain and kind of enhance the pleasure. Silicone-based lubricants last a little longer and may be especially helpful for women experiencing severe dryness. Next is just some lifestyle changes, right? So staying hydrated, avoiding harsh soaps, wear breathable cotton underwear, and that'll help prevent additional irritation. And let's move on to hormonal treatments. So I would say this is by far the most effective treatment is vaginal estrogen for moderate to severe GSM. So vaginal estrogen directly targets the vaginal tissues, restoring the moisture and elasticity. And it's available as creams, as tablets, rings, or inserts. They deliver this low dose estrogen with minimal systemic absorption, which is really important. And then you can also use vaginal DHEA. This is a hormone supplement that inserted vaginally that kind of helps alleviate dryness and improve sexual function by converting estrogen and testosterone um, in the vaginal tissues. Let's see here. Next, we have an oral medication, ospemifene. It's a SERM or a selective estrogen receptor modulator that mimics estrogen's effect on the vaginal tissues without increasing the risk to the breast or uterus. That's really important to understand. It can help reduce vaginal dryness and pain during sex. So there's some advantages there. So it's non-hormonal, but it is an oral medication. Next, you have more advanced therapies. You can do pelvic floor physical therapy. I would make sure that you're seeing a gynecologist, urologist who can refer you to their specific physical therapist that they feel really good about pelvic floor therapy, because not all physical therapists are going to have that specialty. So really, really important that you get someone who knows what they're doing. And next is laser or radio frequency treatments, right? So these newer treatments, they kind of work by stimulating collagen production in the vaginal tissues, which can help improve, again, the elasticity and the moisture. And so while initial results are promising, more research is really needed to confirm that safety and effectiveness for long term. But really, just remember, it's really important that we understand why treating this matters, right? So it not only affects the body, but it affects your relationships, your mental well-being, your overall quality of life. And for many women, the symptoms can interfere with intimacy, making social outings uncomfortable, and lead to anxiety about leaking urine or having sudden urges or recurring UTIs. Again, it's really important that we treat it. GSM, talk to your doctor about it. It can restore your comfort, enhance your intimacy, and improve daily life. So again, just feel free to do that. And by the way, if you've hung around this long, just about this transition that we're all going to go through if you live long enough. So as always, I'm so thankful that you're here, and I'm sending gratitude, joy, love, and healing your way, as we all need more of that in our lives and in this world. So have a good day, everyone.